What's up, TUMNAD lectures? In this video, we are going to be looking at what we call the arteries of the head and then the neck. If it is the very first time to watch it, please make sure you like the video, comment down in the comment section, and please subscribe. Let's go ahead and get started. So now, when we talk about the arteries of the head and then the neck, what should come into your mind is that you're going to be looking at what we call the supply of oxygen-rich blood, nutritious-rich blood, right away from the left side of the heart to the head, and then what we call the neck. That's going to be the reason for what we call over today's video. Let's go ahead and get started. Now, something which is so much basic is that we need to first understand how is the blood going to be leaving the left side of the heart until it reaches into those arteries of the head and then the neck. We are going to be starting from what we call the left ventricle. The left ventricle is a powerful kind of the chamber which is too muscular to make sure that it squeezes the blood as if it has never squeezed before, to make sure that that blood is ejected off from what we call the left ventricle. Now, when the left ventricle contracts, it will squeeze the blood as if it has never squeezed before, and that blood will hit some important kind of the structures which are called the aortic semilunar valve. From there, this blood is going to be entering the different kind of the portions of what we call the aorta. At first, it will hit what we call the ascending aorta. From there, it will now hit what we call the aortic arch, and then to move down to what we call the descending aorta. But in this video, we are not going to be focusing on what we call the descending aorta. We are also not going to be focusing on what we call the ascending aorta. Our main focus is going to be on aortic arch, and the reason is we have three great vessels which are going to be supplying all the different upper extremities, which is going to be the reason of today's video. Okay, so now we have said that we are starting from what we call the left. We are starting from what we call the left ventricle. We are starting from the left ventricle. From the left ventricle, we are coming to what we call the aortic. We are coming from what we call aortic semilunar valve. From aortic semilunar valve, we are moving to what we call ascending aorta. Okay, we are moving to what we call the ascending aorta. From there, we move to what we call the aortic arch. Okay, we move to what we call the aortic. We move to what we call the aortic arch. Now, when we come to what we call the aortic arch, there are three great vessels which are going to be coming from what we call the aortic arch. What are the three great vessels? The first one is what we call the left subclavian. The left subclavian artery. The second one is what we call the left common carotid artery. Okay, and then the last one is what we call the brachiocephalic. Okay, the brachiocephalic artery. Now, these are the three great arteries which comes off from the aortic arch directly. Okay, and of course, when they come off from the aortic arch directly, they start giving off different kind of the branches. What are these branches? When you look at what we call the brachiocephalic artery, what we call the brachiocephalic trunk, it gives off two kind of the main kind of the branches. What are the two branches? The first one is what we call the right subclavian artery, and then another one is what we call the right common carotid artery. Okay, another one is going to be what we call the right common carotid artery. Okay, so now we have said that the left common carotid artery is coming from the aortic arch directly, but we have seen that the right common carotid artery is not coming from what we call the aortic arch directly. It is a branch of what we call the brachiocephalic trunk. Okay, now when you see the left common carotid artery, it also gives off two kind of the branches, especially around what we call the carotid sinus. It gives off two kind of the branches. The first one is going to be what we call left external carotid artery. Okay, that is one branch. And another one is going to be what we call left internal carotid artery. Okay, left internal carotid artery. So now those are the two main kind of the branches from what we call the left common carotid artery. When we come on what we call the right common carotid artery, it also gives us two kind of the main kind of the branches. And the first one is going to be what we call the right internal carotid artery, and then another one is going to be what we call the right external carotid artery. Okay, it's going to be what we call the right external carotid artery. Okay, so now these are going to be the major kind of the branches of what we call the left common carotid artery and what we call the right common carotid artery. Left common carotid artery is giving what we call the left external carotid artery and then the left internal carotid artery. And then the right common carotid artery is giving us what we call the right internal carotid artery and what we call the right external carotid artery. Okay, that is it. Now, in this video, we are going to be mainly focusing on what we call the arteries of the head and the neck. We are going to be looking at what we call the supply to what we call extracranial areas. And when we talk about what we call extracranial areas, these are the areas outside what we call the cranial cavity, like for example, the facial muscles, the tongue, what we call the jaw, the face muscles, some other superficial areas on the temporal bone, the occipital area structures. Those are going to be the areas of today's discussion. Now, the question is, of these branches of what we call the left common carotid artery and then the right common carotid artery, what are those branches which are going to be supplying those areas? It is going to be what we call the right external carotid artery, which is going to be supplying now the right side of what we call the head and the neck. And then on the left side is going to be what we call the left external carotid artery. Okay? Now, because they are going to be 100% the same, I'm going to be using one side, which is also going to be representing the other side. I'll be using what we call separate, what we call the right of what called the face and then the neck. And then for the case of the left, it is going to be exactly the same, and it will be coming from what we call the left external carotid artery. Okay? So now moving with what we call the right external carotid artery, it is going to give us a lot of different multiple of the branches. What are these branches? You're going to be labeling these branches from inferior going to the superior aspect. And the first one is what we call the superior thyroid artery, which is going to be supplying what we call the thyroid gland. Okay, so now the first one here is what we call the superior, the superior thyroid. Okay, is what we call the superior thyroid artery. That's going to be the first kind of the artery, which is going to be branching off from what we call the right external carotid artery. The second one is what we call the lingual artery. Okay, the second one is what we call the lingual artery. So now this one here is going to be what we call the lingual artery. And then the third one is only going to be supplying what we call the jaw. And that one is what we call the maxillary artery, which is also going to be having three kind of the branches. Okay, but this one here, the third one, is what we call the maxillary, artery. Okay, and then another kind of the branch from this kind of the artery is what we call those kind of the artery which is going to be supplying the muscles of the face. For that reason, it's just called the facial artery. Okay, and this one here is what we call the facial, artery. Okay, and also we're also going to be having another branch which is going to be supplying the outer extremities, the structures of what we call of the occiput. Okay, and then that one is what we call the occipital artery. Okay, this one here is what we call the occipital, the occipital artery. And even also have another branch is going to be supplying the superficial areas of what we call the temporal structure, the muscles in the temporal lobe, and even all other structures within the temporal area. This one is going to be what we call the superficial temporal artery. Okay, so now this one, the last one, is going to be what we call the superficial temporal artery. Okay, so now these are going to be the super major kind of the arteries which are going to be coming off from what we call the right external carotid artery. At the back of your mind, I want you to know that even this kind of the left external carotid artery is going to be giving us exactly the same kind of the arteries which are going to be supplying what we call the left side of the head and what we call the neck. Okay? It's all that simple. Now, having seen all that, let's go ahead and look at what we call where does the right internal carotid artery go, and also what we call the left internal carotid artery go. Now, these kind of the arteries, they are going to be entering what we call the cranial cavity through what we call the carotid canals. They are going to be feeding the different structures within the cranial cavity. Okay, and because of that, they are going to be supplying what we call the brain and what we call the eyes. So now, this one which we are calling the right internal carotid artery is going to be moving, and then it enters through what we call the carotid canal. It enters into what we call the cranial cavity, and it goes supply what we call the anterior areas of what we call the brain. It is this kind of these arteries which are going to be contributing to what we call the formation of what we call the circle of wheels. It contributes approximately around 80% of the circulations within what we call the circle of wheels. They are going to be giving us a lot of different kind of the branches. They're going to be having what we call the middle cerebral artery. We're also going to be having what we call the ophthalmic artery. Also going to be having what we call the posterior communicating artery, the anterior communicating artery. So now all these ones are going to be supplying the intracranial structure, which is the brain and what we call the eyes. Okay. So now that is for the case of what we call the right internal carotid artery and then the left internal carotid artery. They are all going to be coming and then contribute the biggest percentage in the formation of what we call the circle of wheels. We shall have the detail of what we call the circle of wheels. Okay. Now, putting that one aside, let's go ahead and look at what are some of the branches which are going to be coming off from what we call the right subclavian artery and even also what we call the left subclavian artery, because they also give us different kind of the branches which also goes ahead and then supply different structures within the intracranial areas. Now, this right subclavian artery and the left subclavian artery, they give off beautiful kind of the arteries which pass through around the cervical vertebrae, around the C6. They pass through what we call the transverse foramina. They move up and then around the C1, they move around what we call the atlas. They move slightly at the back and they pass through what we call the subostral triangle, and then they enter through what we call the foramen magnum. Those kind of the arteries are what we call the vertebral arteries. So now the left subclavian artery will give us what we call the left vertebral, the left vertebral artery. And of course, the right subclavian artery also give us a branch which we are calling the right vertebral artery. Okay. Now this right vertebral artery and then the left vertebral artery, around the pontomedullary junction, they are going to be coming together and they make one of the beautiful kind of what we call the artery, which we call the basilar artery. So now this right and then the left, when they come together, they make a beautiful kind of the artery, which we call the basilar artery. Okay. So now, and of course, this one, the basilar artery is going to be one. That's why I'm not going to be writing it on both sides, because to confuse you to think that maybe they are two, but the basilar artery is one. And of course, the basilar artery is going to be contributing approximately 20% of the circulation within the circle of wheels. Okay, and a great kind of the artery which is going to be connecting what we call the vertebral-basilar system to the circle of wheels is going to be what we call the posterior communicating artery. Okay, and of course, this kind of the basilar artery is going to be having multiple different kind of branches. For example, we're going to be having what we call the labyrinthine arteries. We're also going to be having what we call the pontine artery. We're going to be having what we call the superior cerebellar artery. A lot of the branches are going to be coming off from what we call the basilar artery. We shall look at that one in detail during the study of what we call the circle of wheels. Okay, so now the vertebral-basilar system is going to be also contributing 20% in the formation of what we call the circle of wheels, which supply the posterior aspect of what we call over the brain. Okay, so now that briefly covers what we call the arteries of the head and then the neck. Now, what I'm going to do, I'm going to give you a clear kind of the diagram which is going to be showing all of these main kind of the arteries which are coming off from what we call the different external carotid arteries in a clear kind of the view. You need to have a look at this one by yourself. Thank you very much for watching, and if you think whatever I have talked is making sense, is really adding to your benefiting, please you can support it. And that one can be done by a couple of minutes. You hit the like button, comment down in the comment section, and please subscribe. As always, TUMNAD until we meet next time.